Mexico City's public security chief has survived an armed ambush that left 3 dead. 3 Cuban medical brigades are set to leave for Guinea-Bissau and the Caribbean islands of Martinique and Anguilla to join efforts to fight COVID-19. This Friday saw the inauguration of the 36th Summit of the Association of Southeast Asian Nations, presided by Vietnam. From the headquarters of Telesur English in Havana, Cuba, this is From the South, and I'm Katrina Goss. We begin in Mexico, where the Public Security Secretary of the capital, Mexico City, suffered a gun attack this morning. Omar Garcia Harfuch's vehicle was shot at on Paseo de la Reforma Avenue in the heart of Mexico City. The head of government of the capital, Claudia Sheinbaum, confirmed the attack on her Twitter account. She explained that it was carried out in the morning and reported that Garcia Harfuch was receiving medical attention and was out of danger. The official also added that at least 3 people were killed in the incident and that the corresponding investigations are underway. And following the attack in Mexico City, President Andrés Manuel López Obrador expressed his full support to the victims.
We express our solidarity, our complete and total support to the head of government, to the members of the public security team of Mexico City. The preliminary report says that the head of public security is injured. They are dead. But if there are dead in this attack, it has to do with the work that is being done to ensure peace in Mexico City and in the country.
Brazil's landless workers' movement in Paraná state will be distributing more than 44,000 tons of food to those most in need throughout the weekend. Those on the receiving end of this act of solidarity have been among the most affected by the crisis provoked by the coronavirus pandemic, including those out on the streets on the outskirts of the state capital, Curitiba. More than 230 tons of pesticide-free food has been donated by small farmers of the agrarian reform movement in Paraná since April.
I believe that especially right now, during the pandemic, this action that the MST is taking portrays what Brazilians need to think about. We have to be human beings and share what one likes. It is good for me. Do I need it? Someone may need it. All human beings need that. For real charity is solidarity. Love for your neighbor. It is to think that if there is food on your plate, perhaps someone else doesn't have food on theirs.
At least 65 doctors have died from COVID-19 in Peru since the pandemic arrived to the country on March 6. Peruvian health authorities have denounced the lack of hygiene, personal protective equipment and medical supplies necessary for the treatment of COVID-19 patients. More than 1,800 doctors have been infected with the virus. Of these, 46 are currently in intensive care and 12 are in a critical condition. Peru has reported more than 268,000 coronavirus cases and over 8,000 deaths. However, the government has approved the reactivation of the economy. According to the Vice Dean of the Medical College of Peru, Maguina, epidemiological barriers must be established in cities where the health system has not yet collapsed. Ecuadorian citizens gathered to condemn the visit by President Lenín Moreno to the historic center of the capital, Quito. Residents shouted "Get out" at the president and criticized his government's mishandling of the novel coronavirus pandemic. To date, Ecuador has officially reported more than 53,000 coronavirus cases and over 4,000 deaths, although the health ministry has recognized that at least another 3,000 fatalities in the country were likely to be due to COVID-19. In Bolivia, public hospitals are collapsing and closing as medical personnel fall ill amidst an influx of COVID-19 patients. Meanwhile, there is talk of activating some churches for primary and secondary care. More details with our correspondent, Freddy Mares in La Paz.
The main state hospitals in the city of La Paz and El Alto are practically closed due to the contagion of medical personnel. This is the case at the largest medical specialization complex in the Miraflores neighborhood.
Following the intervention, the patient does the test, and if it's positive, then the staff that is in contact with them means now 2 of them have become positive. That's why we have isolated them and quarantined those suspected cases.
Just in the Miraflores health complex alone, 5 hospitals of different specialities have closed, and the hospitals enabled for care of COVID-19 have collapsed.
There are many limitations that the authorities have not been able to resolve, and the result is that clinical hospitals have closed. The Thorax Hospital, Gastroenterological El Altos Holandés Hospital are closed. Other hospitals have exceeded capacity of patients. We have reached an extreme crisis, and there is risk that people will die at home.
There are no official figures, but it is estimated that there are over 300 infected health professionals in La Paz alone.
One of the most important facilities has 40 colleagues who are ill, others around 20 to 30 sick colleagues. The figure exceeds 200. Today, we must have more than 300 colleagues throughout the department, in the rural area, in the 2nd and 3rd level hospitals affected by the disease.
The crisis is national. Riberalta is an intermediate city of about 100,000 inhabitants in the department of Beni.
We currently have 81 health personnel who are positive, 56 officials infected only in the 1st level. Without counting the 2nd level and other hospitals, we have only reached the critical stage in Riberalta.
Starting next week, Christian churches have been enabled in La Paz to care for patients who are in the 1st or 2nd stage of the disease.
We have more than 100,000 churches in the country. In La Paz, we must have 10,000 churches. In each area, there is always a church. They can be used as transitory centers.
The crisis goes hand in hand with the shortage of testing. In the city of Santa Cruz, the only state laboratory has 4,000 tests pending, which involves a 20-day delay in the delivery of results. 500 tests are being carried out per day, as 3 times that amount is required, all while the Ministry of Health has restricted the enabling of private laboratories.
And we're taking a very short break now, so don't go away. Welcome back to From the South. 3 new Cuban medical brigades are set to leave for Guinea-Bissau and the Caribbean islands of Martinique and Anguilla to join the efforts to fight COVID-19. The move follows requests from these countries' governments and comes in the midst of continued threats and a propaganda campaign by the United States government targeting Cuba's international medical cooperation. Cuban President Miguel Díaz-Canel has slammed the false accusations of the US regarding the treatment of medical personnel. This Thursday, the US House of Representatives passed a police reform bill presented by the Democratic majority. The bill passed with 236 votes in favour and 181 against. It comes in response to the widespread protests over the continued police killings of African Americans and systemic racism throughout the US. The reforms include a ban on chokeholds, the creation of a national database on police misconduct, and the elimination of legal protections that shield police officers from lawsuits. However, the bill is unlikely to make it through the Republican-led Senate and does not enjoy the support of President Donald Trump.
The nays are 181.
And also in the United States, health officials have warned that the true number of COVID-19 cases in the country could be as high as 24 million, which is 10 times the number of officially confirmed cases so far. During a conference call with the press, the director of the Centers for Disease Control and Prevention, Robert Redfield, said that this calculation was based on antibody tests on blood samples throughout the country. Redfield said he believes 5 to 8% of the population has been infected so far. Experts stress that the pandemic remains in its early stages and people need to continue to try to limit the spread of the virus. According to the latest data provided by Johns Hopkins University, the US has reported over 2.5 million confirmed COVID-19 cases and over 127,000 deaths. The General Secretary of the Communist Party of Britain, Robert Griffith, stressed in an interview with China Central Television that China has the right to pass any laws it chooses in its own territory and has shown great restraint in face of the unrest in the Hong Kong Special Administrative Region.
China has every right to pass whatever law it wishes to pass. Clearly, it would be preferable if a settlement of any outstanding difficulties in Hong Kong can be reached within Hong Kong. But if it's necessary, as it's a part of China's sovereign territory, if it's necessary for the central government to step in and take the necessary measures, then it has every right to do so. I think so far the Chinese government and the Hong Kong authorities have shown an enormous amount of restraint in the face of such violence and provocation in Hong Kong. I think that has been quite important in terms of what it says to the rest of the world, because as you know, there are governments and powerful forces in the media around the world who are always looking to portray the Chinese government and the Chinese party in the worst possible light.
A French artist has created a giant artwork titled World in Progress in the garden of the UN headquarters in Geneva as a gift from Switzerland for the 75th anniversary of the international organisation. The biodegradable grass fresco by artist Saipe depicts two children drawing a tree in an imaginary world in chalk, surrounded by a ring of men and women holding hands, together with different animals. The artist said he aimed to remind present generations of their duty to the future and to nature.
I'm super proud because it feels like we're painting on the world a little bit, I would say, since the UN more or less represents the world. We have the feeling of being representative in a place that is highly symbolic for the whole world. Personally, I am firmly convinced that in the end it is together that humanity can respond to the various challenges it faces, and that, for me, the United Nations is more than a need, it is quite simply a necessity. I really think that perhaps it is a bit utopian, but as I see it, it is a place where we should sit around the table and discuss together the major issues that will confront humanity, or the times in which we are currently living.
Lufthansa Airlines shareholders voted on Thursday in favour of the German government's bailout plan, which includes a €9 billion rescue package.
Ladies and gentlemen, the Lufthansa annual general meeting has just voted by a clear majority to approve the German government's rescue package. That's very good news. Good news for the company itself, good news for the Lufthansa employees, and also good news for Germany as a business location. With the financial aid, the federal government is stabilizing a large German company that was in perfect health and has fallen into severe turbulence due to the effects of the corona pandemic.
Firstly, the state's stake serves only to stabilize Lufthansa. The state's quickest possible withdrawal once the stabilization has been achieved is part of our common business basis. Secondly, there will be no political intervention in Lufthansa's business. The companies will continue to meet its responsibilities to all stakeholders, for the shareholders, the employees, for the customers, and also for society and the environment.
Für die Kunden und auch für Gesellschaft. Yes.
And we have more stories coming up after this final short break, so stay with us. Association of Southeast Asian Nations in Hanoi, Vietnam. Vietnamese Prime Minister Nguyen Xuan Phuc presided the plenary of the summit, with member states participating via video conference in the wake of the novel coronavirus pandemic. During his speech, the Vietnamese PM called for a continued cooperation in the fight against the pandemic and to consolidate the central role of the association in the region. ASEAN was founded in 1967 as composed of Malaysia, Indonesia, Brunei, Vietnam, Cambodia, Laos, Myanmar, Singapore, Thailand and the Philippines.
The COVID-19 epidemic has interrupted the discussion meetings on the development of the Code of Conduct on the South China Sea between ASEAN and China. In this context, Vietnam strives to work with ASEAN in cooperation with stakeholders to refrain from actions that complicate the situation at sea and to comply with international law. ASEAN wants an Asia-Pacific that is peaceful, stable, prosperous, and with cooperation for development. It doesn't want to take sides.
Indian authorities reported 18,000 new coronavirus cases in the past 24 hours. This brings the total number of people infected by the virus in the country to over 500,000, representing the fourth highest total in the world. Meanwhile, the death toll stands at over 15,000. On the other hand, almost 296,000 people have recovered from the virus. The most affected states in India are Maharashtra, with more than 140,000 cases and nearly 7,000 deaths, followed by New Delhi with over 73,000 cases and close to 2,500 deaths. A huge explosion at a gas storage facility lit up the night sky in the Iranian capital, Tehran, on Thursday night. According to the Defense Ministry, the blast fortunately caused no casualties. The fire broke out in a non-residential area and was quickly controlled. Local media showed the aftermath of the explosion in daylight, with at least 2 large cylindrical tanks damaged by fire, along with a scorched field nearby.
A gas tank exploded in the Persian public area between 11 p.m. at midnight last night, and the blaze was immediately brought under control by the firefighters. Thank God there were no casualties. Our colleagues are at the location for further investigations and, God willing, as soon as we receive additional information, we will provide it to the public.
In Uganda, the Ministry of Health has announced measures to contain the spread of COVID-19, as well as the creation of an app to train healthcare workers remotely. We have more details from our CGTN colleagues.
Minister for Health, General Chen, has said Uganda has progressed to stage 3 of COVID-19 pandemic with clusters of community transmission, meaning serious containment measures are needed for any eventuality.
The expansion of the hospitals to the 40,000 beds has already begun. We have the designs, the contracting process is ongoing, and the mobilization of resources. And we do hope that not later than 1 month's time, this will begin. The training of the health workers already began. So recruitment is also ongoing for additional health workers.
The minister also noted that Nambole Stadium will be used to accommodate mild and moderate cases of COVID-19 in the country.
And we move the mild to moderate cases to large areas like Nambole, where we can have segregated auxiliary cares that can handle maybe 200, 250 groups separated, because they don't need too much attention.
The minister also warned people in Kampala, especially in crowded places like Chikubo, taxi parks, to always be vigilant and follow the guidelines.
That we do have danger. In Kampala, we have recorded over 34 cases. These 34 are an area of concern. They are among us. If we have removed 34, we don't know who is out there. We could only know if we were doing mass testing, which we are not able to do.
In the same development, the Ministry of Health and Community Health Academy at Last Mile Health, Makerere University College of Health Sciences, has launched a capacity building up.
It's timely because we know that we are not supposed to be in that close proximity with each other, so we need to recognize social distancing as required by the guidelines of Ministry of Health. So this app gives an opportunity to be in a class, to learn and have your capacity built without necessarily being in a group of people.
The app closes the training gap by providing access to multimedia content with up-to-date information related to COVID-19 response directly on a smartphone.
And this capacity building application is a large boost to our endeavors to train health workers. Our aim is to have many cohorts of case management teams, large cohorts of surveillance officers, contact tracers, psychosocial people, and so on and so forth. We need everybody to be knowledgeable, not only about COVID, but also about the other essential services and the need for us to maintain the gains that we made over the years.
According to the World Health Organization, 80% of people suffering from COVID-19 will have mild to moderate cases and 20% with severe cases. Zahara Bigaba, UBC.
And we've come to the end of this news brief, but you can find these and many other stories on our website at telesurenglish.net. And you can also join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.